Patients with illnesses like myalgic encephalomyelitis, also known as chronic fatigue syndrome, can often develop hypothyroidism. Now, their form of hypothyroidism is usually different from classic hypothyroidism. Instead, it is usually something called low T3 syndrome. In this video, I'm going to explain what low T3 syndrome is, why it might develop in illnesses like ME-CFS and long COVID. I'm going to talk about treatment for it using T3 monotherapy, and I'm going to talk about my own personal experience as someone who took T3 for 2.5 years. But I'm also going to talk about why I decided to come off it and how I did so, because I don't believe that T3 is the best treatment for everyone. But first, if you are new to this channel, my name is Patrick Usher and I'm an ME-CFS patient. And this is a place where I talk about the research into ME-CFS in an accessible way, so that you, the patient, can be better empowered in understanding your condition. It's also a place where I talk about the various treatment strategies that I have used in order to improve my condition. If that sounds of interest to you, please do like and subscribe. So, hypothyroidism, it's when the body's metabolism slows down. You start to become cold, constipated, your skin becomes dry and peeling, your nails become brittle, as does your hair. Now, classic hypothyroidism is thought of as one kind of phenomenon. It's when your TSH, your thyroid stimulating hormone, goes high, you're not producing enough T4, which is the inactive form of thyroid hormone, and therefore there's just not enough of the initial thyroid impetus for your metabolism to be working optimally. But you can also have something called low T3 syndrome, and this operates in a very different way. So in thyroid physiology, T4 is the inactive form, and normally that gets converted to the active form of T3, and T3 is the hormone that actually goes into the cells and instructs the cells to increase their metabolism. However, in this conversion process from T4 to T3, sometimes the body does not do that conversion optimally, and instead it shuttles off a lot of the T4 into something called reverse T3. Reverse T3 is another hormone, but it's an inactive form of T3. It's a dead form of T3. It has no physiological impact on the metabolism. And so sometimes, for various reasons, if the body is creating a lot of If it's shuttling off a lot of T3 into reverse T3, it's missing out on creating an adequate amount of T3 for the body's metabolic needs. And so in this way you develop a form of hypothyroidism. The labs can actually look normal or pretty normal. Maybe the T3 is slightly low, but they can actually look fine, and the doctor will say there's nothing wrong with your, you don't have hypothyroidism. But what they're not testing for is the reverse T3. And if that reverse T3 is high, it's actually showing that the body is down-regulating thyroid metabolism. Now, awareness about this problem has often come from within the patient community. Websites like Stop the Thyroid Madness, or the T3 advocate Paul Robinson, who had terrible thyroid problems before he worked out that this kind of conversion issue was actually his problem, have done a lot of work in terms of trying to raise awareness that this can be a problem. And so the solution, as it is often portrayed, is not to take the standard hypothyroid treatment, which is levothyroxine, T4. Normally people take T4, and the idea is you're topping up the inactive form and you have more of the inactive form then to convert into T3. But if your problem is a conversion of T4 to T3, then that's not really going to help you. In fact, it will just end up creating more reverse T3 and exacerbating the problem. And so the solution, as has been put forward by people like Paul Robinson, is to take pure T3. So you actually bypass this conversion issue altogether. Because if you take enough T3, and this is called liothyronine sodium, and some of the brand names, the drug names are Sinomel, Cytomel, Liotyr and others. If you're taking that at a high enough dose, you're actually giving your body the active hormone, and you therefore completely bypass the whole conversion issue from T4 to T3. Your body stops having any reverse T3, and you just have T3 going around instructing your metabolism to increase. Now, when you're taking T3, of course, you actually suppress your thyroid completely, so it is regarded as a treatment of last resort. When the brain and the thyroid sense that there's adequate amounts of T3 floating around the bloodstream, it will suppress and make dormant your actual thyroid gland. So people who take T3 treatment are really in a very mechanical way and a very blunt way stopping their hypothyroidism. Now this is a channel about ME-CFS, and so we need to ask ourselves, what's the application of this to ME-CFS in particular? Well, a lot of ME-CFS patients, or at least a significant number, become hypothyroid, and it's often in this low T3 syndrome kind of way. Indeed, there was a paper about this that found that this was a phenomenon that exists in ME-CFS patients and which recommended the consideration of T3 treatment. And personally, I've come across a fair few ME-CFS patients who are on this kind of treatment. Now the question is, why does it happen? Now if you look at people talking about T4 to T3 conversion issues, normally they bring up all kinds of issues. Hashimoto's thyroiditis, an autoimmune problem. They talk about not taking enough specific nutrients like selenium or iodine. But in the case of ME-CFS, although it has been found that there are selenium autoantibodies in some patients which may be contributing to T4, T3 conversion issues because selenium has a role there, and although low iodine may well be an issue and supplementation with that could be important, the most likely reason, in my view, as to why ME-CFS patients develop this kind of hypothyroidism is that it is simply a response to the illness itself. So the illness itself is very stressful on the body. You've got low blood volume, you have low blood perfusion in the muscles due to autoimmune and vascular issues and microclots. You have the nervous system going haywire, you have cellular issues going haywire. The thyroid simply responds to that. The brain senses that the body is in a bad way, that times are not good, and because of that, it chooses, in my view, to downregulate the metabolism. Because basically the body is in a survival state, and because it's in a survival state, it sees no reason to upregulate metabolism, because that's what you do when you're thriving. This also ties in with the research of Robert Navio, who talks about ME-CFS as involving a survival or Dauer state. Dauer is the German word for survival, in which the metabolism is downregulated and in a kind of hibernation mode. And therefore we come to the rationale for treatment. So if someone is in this situation going to take pure T3, and I'm not going to talk about things like T4, T3 mixes, this is not something that I'm a personal experience with. There's plenty of other people who talk about that. Paul Robinson's books are very good for a wide overview of the different options of treatment. But the rationale for pure T3 treatment in this kind of context would be, yes, your metabolism is downregulated because of your illness, but let's actually instruct your body to think, at least from a thyroid perspective, that you are thriving again, that your metabolism, it is back at a normal or robust kind of place, and let's work on you from this angle to trick your body into thinking that times are better, that the and to give it the benefit of a metabolism that's in a good way. So that's the background to low T3 syndrome in ME-CFS and a rationale for treating it with T3 or liothyronine. And now I'm going to talk about my own personal experience with hypothyroidism and using T3 treatment. So as my illness progressed, and I have been ill for 6 years now, within a few years I started to notice hypothyroid symptoms. So I was cold, I was constipated, I had dry skin, my hair, my nails were brittle, etc. And I wondered, did I have this low T3 syndrome? Did I have high reverse T3? But for a long time I just struggled with these symptoms. Then I had a consultant who specialises in seeing ME patients, and he talked about treating me with T3. Anyway, he got me to test for my reverse T3 levels, and they were very high. They were actually 38. And often people would say a score over 20 or 24 is indicative of this reverse T3 problem, this low T3 syndrome. So that fit very much with my situation, and my consultant suggested to T3, and I agreed. So I started out with 25 mcg for a few months, which was kind of a bit slow going, really, and I actually felt worse. After 3 months, I went up to 50, and then after 8 or 9 months, I went up to 62. And so my dosing schedule was 25 at 8 a.m., 25 at midday, and 12.5 at 3 o'clock in the afternoon, and that's where I stayed. Once I got up to 50, I did notice a difference, and I felt warmer. However, I never really felt dramatically better, and I really hoped that I was going to feel dramatically better because people talked about that. And in fact, in some ways, I felt worse, and I didn't really connect the two for a long time. But what I used to feel was, particularly in the morning, I'd feel pretty dead a lot of days, and really like it was hard to wake up and get going. I felt like I was squeezing cortisol out of my adrenals. The cortisol, the waking response, a real brightness of mind that happens early in the morning where you feel bright and you're kind of alive, that didn't seem to be happening, and I was feeling quite just hard to get going, and if I was in a crash or crashy, that would really exacerbate these problems earlier in the day. So the kinds of symptoms that I'm describing that I developed more obviously when I went on T3 treatment are concordant with low cortisol. Now, cortisol is what's released by the adrenal glands, in response to stress, but it's also released ideally in a robust way every morning to wake you up and to make you feel bright and alive and ready to face the day. And before I took T3, my cortisol levels were always pretty fine. In fact, they were often quite robust. I didn't test my cortisol for the first 2.5 years that I was on T3, but I was starting to wonder around January of this year, is there something going on with my cortisol because of the T3? And I asked myself that because I was learning that actually there is a strong link between T3 hormone and the release of cortisol. More specifically, in the healthy human being, at around 4:30 to 5 a.m., the thyroid will release a little bit of T3 to kickstart the adrenals into action to release cortisol. In other words, the release of cortisol in the morning in a robust way depends upon the stimulation from T3. Now, the problem is, if you are taking T3 monotherapy, as I mentioned earlier, you've so much circulating T3 from what you're taking that the body has shut down normal thyroid function. Because of that, when it comes to 5 a.m. in the morning, there is no stimulatory kick. There is no T3 released by the thyroid to get the adrenal glands to release cortisol. As a result, you can develop a hypocortical state from T3 treatment. You can actually develop an insufficient amount of cortisol. Now, I tested my cortisol in January because I was thinking, is this happening? I did a spit test and the results came back and they were shocking to me. I was significantly insufficient. I was underproducing cortisol below the reference range. So when I got this result, it explained a lot to me. Something had felt missing since I went on T3 treatment. That early morning, robust feeling of waking up, bright mind, and ready for the day. Obviously with ME-CFS you can have days where you don't feel that at all, and there's ways in which the illness can downregulate cortisol as well. But in general, I started to miss that response more and more. So suddenly I connected the dots. I was living with a quasi-Addisonian level of cortisol for a few years, and this is not an acceptable side effect from my perspective. So when I worked that out, there were essentially two options. Either I take T3 at 4:30 in the morning, or I try to come off it. Now the first option is actually what Paul Robinson ended up having to do, because when he was just taking T3, he didn't do very well either. When he wasn't taking it at 4 a.m. And what he found when he did that for a few years, and then he found out about the connection between T3 and cortisol, and he experimented with taking T3 in the middle of the night in order to see, does that can he get his adrenal glands into action to actually get cortisol going. And he found that he profoundly could, and he felt way better. And in fact, that's what led to his recovery. And there are quite a few people with these kinds of conversion issues, thyroid-wise, who do this thing of taking T3 at 4 a.m. It sorts them out. They get their cortisol response back, And because, in fact, in order for T3 to get into the cells, you actually need adequate cortisol because they work together. Cortisol and T3 get into the cells. So suddenly, not only do people get their cortisol back, but they get their T3 actually for the first time getting into the cells as well. So they become euthyroid and proper cortical function as well. And so you can learn more about this particular approach, so-called T3 Circadian method, in Paul Robinson's book all about that. And so that was one option for me. The truth is, I didn't like being on this treatment because I didn't like suppressing my thyroid. I didn't like the idea of taking something that was making such an essential part of my body completely dormant forever. I also didn't like the idea of taking a pill at 4 a.m. and having to set an alarm every day and so on. Some people are happy with that kind of thing. I like to keep my sleep protected. So what I decided to do was to try and come off the T3 and see how I was doing. See if things were better now, because I am much stronger now than I was when I went on the T3. And I reduced the T3 over 2 months. I was actually very scared about this because my thyroid had been completely dormant for 2.5 years. And I was worried about, how would I manage? Would I become very ill trying to get off it? There's something called a hypothyroid crisis. It has a high fatality rate. So I was worried about all of that kind of thing. I reduced 6.25 every 3 to 4 days initially. Once I got down to 30 mcg, which is the point at which when you go below that, you're starting to kick the thyroid back into action, I would decrease by, I went from 25 to 18, that was a week. And then when I went down to just 12.5, I stayed at 12.5 for 2 weeks. So I really let my body get used to having to do 60% of the work while still supporting it. And then I went down to 6.25 for 8-9 days, and then I stopped. Now, during that process of coming off it, it wasn't particularly pleasant. I could be really cold at times. Really, really cold and tired. Like colder than I've ever felt, really. But at a certain point, I did become less cold, and that kind of receded, and I started to feel like my thyroid was coming back to life. What I also felt, especially when I was getting down to a half tablet, 12.5 mcg, was that my cortisol was coming back to life as well. And I was getting what I had missed more often than not for all of those years being on the T3, this sense of the robust, awakening response that was making my nervous system feel more solid again. So I felt like I was getting cortisol back. So that was really very encouraging. And now, I'm completely off it. I have been off the T3 for about a month. And, I haven't developed a hypothyroid crisis. I feel like my cortisol is working better. And in many ways, I overall do feel better. However, I would say that I am a little bit hypothyroid. That's my feeling. I would feel that I'm not as warm as I would like to be. I do feel that, my metabolism is not as quick as I would wish for it to be. I have not tested, TSH and T3 and reverse T3. I hope to do that at the end of the summer and see how everything is going as I've been off it for a while and see how my thyroid has resumed activity. In truth, my thyroid issue before, most likely, it was just a response to the illness. It was actually, in a way, the wisdom of my body. And so my aim, if I am still hypothyroid now, is to work on everything I can in order for this conversion issue, T4 to T3, to normalize itself. And it's only if I fail every natural option would I consider to go back onto T3 with this circadian T3 method. Anyway, that's the story for this video. Basically, I kind of wish I'd never done it. I wish I had looked into ways that I could perhaps affect the reverse T3 myself. But I did take it, and it did, I believe, have this effect negatively on my cortisol. I am now going to be trying I'll be monitoring this now closely in a few months, and then I will see what the situation is. I'll do another video then to update people. And if I am still hypothyroid, I'm going to try my best to overcome that naturally. And I don't wish to mess again in such a profound way with the natural endocrine signals that go on in my body, and which have a wisdom which are far wiser than the blunt mechanisms of any given pill. So please leave your thoughts down below. Do you take T3? I know plenty of people do very well with it. Have you had low cortisol while on T3? What do you think of this as a treatment? What do you think in terms of ways to improve T4 to T3 conversion, please leave your experience down below, and I look forward to chatting with you in the comments.